Dr. Susan Vaitekunas, co-director of the Anna and Louis Goldfarb Jewish General Hospital in Montreal, Canada, recently delivered a public lecture in Barbados on dementia. In this, the final part of the presentation, she discusses prevention, treatment options, and research findings.
I have to be honest, the two most important factors in whether people are going to develop this disease or not are things that we can't do anything about. First of all, it's your age. We can't turn back the clock, right? So dementia becomes more common as people age. At age 65, about 5 to 7% of people will show signs of dementia. At age 75, 10 to 15, and over 85, depending on the study, somewhere between 1/4 and 1/2 of people have thinking and memory problems. The other major risk factor is our genes. I mentioned that there are people who have, unfortunately, have carried genes which predispose them to very, very early Alzheimer's, but most forms of Alzheimer's that occur in late life are probably a result of a combination of genes, and so we don't really understand what they are, and we can't test for them. But there are things you can do, because in spite of your age and in spite of your genes, if you live healthy, even if you're predisposed to this disease, perhaps you can postpone it by 10 or 15 years, which is a good thing. So what can you do? Well, first of all, it's all about healthy living. So avoiding street drugs. So things like marijuana and cocaine are very, very toxic to the brain. You want to make sure that you get adequate sleep, because sleep deprivation is stressful on the body and the brain. You want to avoid smoking and excessive alcohol. You want to make healthy food choices. Remain physically active, and doesn't mean you have to. I'm not talking about going to the gym every day for 2 hours. We're talking about between 2 and 2.5 hours a week of moderately brisk exercise, a brisk walk, for example. So extremely doable. You want to stay socially connected to other people. You want to spend time with other people, with your family, with your friends. Don't know what it is about it, but it's good for the brain. You want to engage your brain in activities. You know, it's that old adage, if you don't use it, you lose it. So things like crossword puzzles, Sudoku, chess, bridge, other card games, Scrabble. Coming to a lecture like this, you're stimulating your brain, you're making new brain connections. You want to reduce stress in your life as much as possible. You want to live safely, and by that I mean protect your head. Okay? Wear your seat belt. If you drive a bicycle, think of getting a bicycle helmet and wearing it. Avoid sports where people tend to hit their heads. We see a fair number of hockey and football players, and also people who were boxers early in life and got hit in the head a lot, because every concussion that you have is going to predispose you more to develop dementia later in life. Another thing that we know that's protective is getting a good education, and the more education, the better. The other thing, learn a second or a third language. So, because we know that people who speak several languages have extra protection against developing dementia. And lastly, possibly taking a multivitamin with brain protective vitamins like folate, B6, and B12. What you eat really affects how your brain does. So you want to maintain a normal weight. Being overweight predisposes you to developing diabetes, and research shows that if you have diabetes, you're probably 2 to 3 times more likely to develop dementia. You want to eat lots of fruits, vegetables, and whole grains. You want to take antioxidants in your diet, which would be in oranges and other fruits and juices. One of the diets that have been shown to be protective against developing dementia is the Mediterranean diet. Now, this is a diet that involves the intake of a lot of vegetables, a lot of fish, a very small amount of red meat, and that would be, just several times a month, and olive oil instead of butter. Another thing that is possibly protective is coffee, which I love. So up to 2 cups a day. Red wine, which I also love, a half to 1 glass a day. Contains something in it that's got antioxidant properties. The intake of fatty fish, that would be things like salmon, mackerel, sardines, twice a week or more is good for the brain. And flavonoids, which are found in things like blueberries, strawberries, and dark chocolate. So if you like chocolate, dark chocolate though, but just moderation, a square or 2 a day. Well, one thing I want to make sure I do is control things that predispose them to strokes. And that would be making sure their blood pressure is well controlled, that their diabetes, if they have it, is well controlled, and that their cholesterol is good. And it's very interesting because we find that people with dementia nowadays don't deteriorate as quickly as they did 30 years ago. Now, why is that? Well, when I went to medical school, I was taught that it was normal for blood pressure to go up as you age, and that we didn't treat high blood pressure in people over 75. We know now that that's wrong. And so just the control of blood pressure can make a difference. If they're depressed, I want to treat the depression first before I do anything else, because depression, in my experience, can make them appear much more demented than they really are. Optimizing other chronic medical conditions. So if somebody has a little bit of heart failure, I want to make sure that their heart failure is well controlled, that their kidney function is optimized, all that sort of thing. Another thing that's very important is to support the caregiver. And this is part of the treatment of dementia, because dementia is not just the person with the disease, it is the people around them. And I think it's just as important to support and make sure that the caregiver, one, becomes educated about this disease, because with education and understanding, the job is going to be a little bit easier. I also want to make sure that I want to evaluate their level of burden and make sure that they're getting some respite. Because as I say to the caregivers of people with this disease, you're running a marathon. And right now, you're running at full speed. And you're not going to get all the way through the marathon. You've got to pace yourself. So at home, we have local community centers that offer psychosocial care. So I try to hook these families up with a social worker, and that therefore they can access things like day programs, so the patients can go out 1 or 2 days a week, give the caregiver a break, and they also have somebody with a social worker, they have somebody to turn to when they find things are getting more difficult. There are drugs that we use in dementia. The commonest ones are a class that we call cholinesterase inhibitors. So we know they're symptomatic treatments, so they're not getting at the root cause of the disease. So we think of, in vascular dementia, it's the circulation. In Alzheimer's disease, it's those plaques and tangles. Now, the drugs we use now, they don't do anything with the plaques and tangles, but we know that in the brains of people with memory problems, there's a chemical that's very important for memory. It's called acetylcholine. And in the brains of people with dementia, this chemical is very low. And so what these drugs do is they help to raise the level of that chemical. Now, so therefore we call it a symptomatic treatment. Now, as I mentioned earlier, these medications are most effective when started early in the disease. At the very first, the earlier they start them, the more effective they are. But they can have some effect throughout the spectrum of the disease, even till the late stage. They have a mild to modest effect, though. So generally what families will say to me is that they find that the person is more present, more aware of what's going on. So they'll say, well, he's more likely to participate in the conversations, or, and it works most on behaviors like apathy. So people with dementia tend to become apathetic. They don't have to get up and go. They'll sit down and they just sit. They don't do anything. So it may be helpful for that kind of thing. But I think I always feel it's important to tell people, don't expect a miracle. Don't expect them to go back to where they were 2 years ago. But this is a disease which time progresses, and I've had a number of people on these medications who sort of stabilize, and they stay the same. So I tell people, listen, if you come back in 6 months and you tell me he's the same rather than he's getting worse, to me that's going to be a benefit. I think the most exciting thing is what are sort of immunization trials. So what we're doing, there's a number of these going on, and what it involves is injecting people with antibodies against that protein, the plaque that accumulates in the brain. So by injecting them with antibodies, these antibodies will go into their brain, attach to those plaques, and then the person's immune system is mobilized to come and eat up those plaques. And it'll be very interesting to see if by taking away the plaques we can take away the disease. Another very interesting thing is, I showed you the microscope slide of the plaques and tangles earlier in the disease, and it's been a problem that, as a clinician in the office, we can be roughly 85 to 90% certain that a person has Alzheimer's disease. But if we really want to say with 100% certainty, we used to have to wait till they died and do an autopsy of their brain. But now we've developed techniques so that we can actually see the plaques in people's brains while they're alive. And that's using a technique called a PET scan. It's not quite an X-ray. What we do with this is they inject through an intravenous into the person's blood a chemical that's got a radioactive label on it. And then they put them into a machine which shows where that radioactive label goes and gives us a picture of the brain. We're now looking at using this, looking at people. Remember I mentioned the people who were at that pre-dementia phase where they just had the memory problems, and so now we can, in research studies, people are looking at these people and doing these kind of scans to see, is it the people who have plaques in their brains who are going to go on to progress or not? Is this going to be a useful study to help us determine, tell people what their future holds? So over the next 5 or 10 years, I think with these new techniques, we're going to have some very, very interesting results come out.
The Barbados Alzheimer's Association meets the last Thursday of each month at its headquarters, Bethesda, Black Rock Main Road. For information, please call 438-7111.